Support for Radio Friends comes from IT Como, offering computer and IT services for small businesses and residential clients. IT Como can set up remote work-at-home solutions and data security and backup systems and upgrade your company email to more modern platforms. IT Como can also help you get the most from your technology at home. Learn more at itcomo.com. Good morning and welcome to Radio Friends on this Friday, September the 9th. Always a pleasure to have you with us today. Got a couple of guests that I want to introduce you to from Burrell Behavioral Health Center. And neither one of them have been with us before. Marissa VanDover, good to have you here, Marissa, and
Thank
Matt
you.
Gass. And Matt, you are president, right?
Yeah, I am. Absolutely.
Yes.
Thank you.
Pleasure to have both of you here. Now, the reason you're here today is to talk about that you're opening a behavioral crisis center very soon. How did this come about, and do you feel, what is the necessity of it?
Yeah, so let me start with the necessity. I think we know people are in crisis, and we know that this is a big need for the community, and it's really important to have one in Central Missouri, to have one located right in Columbia, and we are really excited to open our doors.
When you talk about people who are in crisis, where are we going here? What type of crisis are you going to be dealing with?
Yeah, so that's a great question because it could really be a lot of things. When I think about crisis, I think about an event or situation that really exceeds someone's current coping mechanisms or exceeds the resources that they have available to them. And so we also think of crisis as self-defined. So a self-defined crisis just means if you believe you're in crisis, we also believe you're in crisis. So that could be anything and everything. It could be, that you are in need of a community resource and you just don't know how to get connected. It could be that you're in need of ongoing care for your mental health concerns. It's really no wrong door, and it doesn't matter what your crisis is. If you find yourself in need, you can walk in our doors, and we have a team of people who's ready to meet you at the door and to help you problem solve.
Now that's comforting to know that. And I'm sure there may be some people listening to us who say, there is help available. I don't have to deal with this alone, because it can be very frightening if you're in a crisis mode. And everybody is different. So what consists as a crisis mode? But to think that there is help out there. What do you want to add to that, Matt?
I think if you're trying to figure out what a behavioral crisis center is, I think as a community member, you can think about this as a 24-hour urgent care. So it's an opportunity for an individual to voluntarily come in and say, hey, I've got some need and I don't know how to access that. Sometimes finding care can be confusing, and this is a giant access point for any behavioral health service that the community offers.
I like the way you described that, a 24-hour urgent care. So 24 hours a day.
Absolutely. Because we know that a crisis doesn't stop just because our business hours close. And so you're just as likely to have a behavioral health need at, 11 o'clock at night or on a Saturday afternoon.
Or 2 o'clock in the morning.
Absolutely. And so we don't want to ever have a closed door. As Boone County's designated mental health agent, that's the special designation that we have that really ties into the broad range of crisis services that often people don't know about. And so this way there's no wrong door. If you think about it in Columbia terms, we often use a roundabout as an analogy, right? And so before a behavioral crisis center is in place, people have to decide which intersection to take and where to turn off from that. And so with a behavioral crisis center, it's a roundabout. 24 hours a day, 7 days a week. When this center opens, you will be able to have almost immediate access to a licensed clinician.
So when will it open?
Soon. soon. And so, like other businesses in the community, staffing is important. And so Marissa and I were just talking a few minutes ago. She's hired 50% of the nursing positions that we've got open. And so as we in the upcoming weeks get those positions up and going, we'll start with a soft opening for about 2 weeks for law enforcement, EMS, fire, so that we can refine our processes, make sure that it fits the needs of this community. And then within about 2, maybe 3 weeks from that, then we'll open 24 hours a day, and you'll start to see some more media and advertising for us saying, hey, we're open. Use us for any crisis need that you would have.
Now, when you're talking about a crisis, would there be inpatient service, or is it strictly walk in and walk out?
Yeah, do you want to talk about that, Marissa?
Sure. So it really is not inpatient. We don't have any beds, although we will do referrals if that's what's needed. Somebody could be with us for up to 23 hours while we work on resolving their crisis. Different crises will take different amount of times. Mm-hmm. And so we're prepared to meet people where they're at, to brainstorm, to get all of our professionals together and really figure out what needs somebody has when they come into the clinic, and that we're ready to keep somebody for as long as it takes to resolve it.
Okay, I want to clarify one thing. You said we'll meet people where they're at.
Yeah.
They need to come into you, though.
Yes.
Okay.
So they need to come in.
You do not go out to...
That's correct. We're not going out in the community. They need to come into our center. I guess I meant more mentally. We will meet people
okay.
where
So
they're
we
at,
wanted to
and
just clarify that. When you say
you.
meet people wherever they are in that crisis, you're there to help them.
We are. And they can come in, with a referral. They can come in on their own. Some people will come in with the support of family and friends or a community professional, or people can just walk in absolutely on their own, no referral needed.
What about insurance?
So we will take insurance, and if somebody doesn't have insurance, we will serve them regardless of their ability.
Okay, that's the important thing to keep in mind. So if you got a problem and you don't have insurance, they still will take you. You will not turn anyone away.
That's correct.
All right. If people want more information about this, where can they go? When will more information be available?
I think it's always a good opportunity to go to the burrellcenter.com webpage. Learn more about our crisis services there. The other thing that we ought to talk about for just a moment is 988. And so much like 911 is an opportunity to call and an easy number to remember during an emergency, the National Suicide Prevention Hotline used to be an 800 number. It was difficult to remember. Now you can just dial 988. It will route you into that suicide prevention lifeline, and then that call will be routed directly to the Burrell Behavioral Health 24-hour crisis line.
So keep that number close if you know anyone who is having problems, or if you yourself are having problems. 988.
Yes, sir.
That is a life-saving number. That's a suicide prevention hotline anywhere in the country.
And it'll route you to your center.
If you're here, it'll route you into Burrell. Thank you so much. 988. For more information, you can contact them on the website. Pleasure having you both here today.
Thanks,
Thank you so much.